have 72 active cases. That means 72 people in isolation. We have 9 who are hospitalized. We have had 12 deaths, and we have a total of 806 cumulative positive cases in the county since we started testing. And there have also been 28,251 tests done in Champaign County. As we move into phase 4, I just want to remind everyone that it's important to remember that everyone must still continue to adhere to the guidance. That means wearing a mask in public, especially when you're in any type of building, to continue to socially distance. Just because things are opening up doesn't mean that the virus has changed or that things are safer to do. It means that you still have to remain vigilant on those specific areas. Moving forward, we need to make sure that persons who are most vulnerable remain protected. So that means if you're out doing something, you need to make sure that you are wearing a mask and not risking exposing anyone. This is not a time to take a break from the practices that we have been implementing for the past 3 months. This is going to be the new normal. This is stage 4 or phase 4 is what it will be until the pandemic ends. So people need to really be cognizant of that and make sure that you are continuing to do what we've always had to do since the beginning of this: mask and remain 6 feet from people at all times.
Thanks, Julie. Next, we'll go to Champaign Mayor Deb Finan.
So I've been asked to speak with you just a little bit about entering phase 4 on Friday. I know that many of our businesses are excited about the possibility of either reopening or expanded openings. We have been working with our bars and restaurants. They are allowed to now seat as many as 10 people at one seat. They can fill to 25% capacity. And so they've been working on getting their numbers. Their tables have to be about 6 feet apart. I believe that most of our bars and restaurants are still requesting that you actually make a reservation so that you're able to get in and out, and that they, are able to plan for the number of people that they're going to have. So we ask you to continue to do the things that Julie mentioned, but I would ask you to also be kind and be patient. This weekend in particular, as people adjust to the additional changes, there will be challenges. Their servers will have some challenges. And so, just give people the benefit of the doubt as we move forward into this next phase. I also want to draw your attention to the fact that retail will be more active, and many retail places, I think, will have retail available outside as well. And so, you can take advantage of that while continuing to wash your hands and wear your mask. So we're looking forward to this next phase.
Thank you. Next will be Urbana Mayor Diane Marlin.
Well, in addition to everything that Julie and Deb have mentioned, I would emphasize we're also helping our business community retailers move to the next phase. One thing we're looking at is modifying city code to really take advantage of our sidewalks and allow for outdoor retail sales. I think our outdoor dining and seating has gone just amazingly well, and we've been blessed with really good weather. So, except for that rainstorm the other day, but so the fact that we can be outside, I think, is safer than being inside, frankly, even though you can be. So I'm encouraging people to sit outside, shop outside. I was reading you can even do haircuts outside. So I look forward to our salons and barbershops even being creative in that way. The other thing we'll be doing over the next couple of weeks is a very, very gradual transitioning for some of our employees to come back to work in the city building. We have real space challenges, so there will be people working remotely for the foreseeable future, but we are able to bring some people back, and I think that will make things a little bit easier. But we have to make modifications to the building, to the workspaces, make sure we have all the practices in place before that happens. So several people have asked, well, when is the city building going to open again? And I have to say it'll be a very gradual transition. Our city building is also our only police station and our main fire station, so, and our only administrative center. So we have three huge functions going on in one building. We've got people who live there 24 hours a day, our firefighters. So we have to take extra precautions to keep employees safe as well as the public's safe. So it's a challenge and it'll be slow.
Thank you. Next, we'll hear from Lisa Benson from the Champaign County Regional Planning Commission.
Thank you for the opportunity to inform our community about some of the resources available to households in Champaign County that have been financially impacted by COVID-19. The Regional Planning Commission has been provided funding through the CARES Act to administer COVID-19 relief programming with two primary focuses: housing and health. Housing assistance will focus on helping households maintain the basic needs of housing and utilities. Financial assistance will address past due rent, mortgage, and water bills that have been unable to be paid since April. RPC will also administer a short-term tenant-based rent assistance program through partnership with the City of Champaign and City of Urbana's housing assistance programs. Utility assistance will be provided through RPC's Low-Income Heating Energy Assistance Program, often referred to as LIHEAP. RPC also aims to address physical health and well-being through food assistance and prescription medical supplies. The provision of prescription and medical supplies assistance will be accomplished through a partnership with the Champaign County healthcare consumers. I'd like to do a brief review of the eligibility for the assistance I've talked about. Households must live in Champaign County and have been financially impacted by COVID-19. The household income for the past 30 days needs to be at or below the 200% federal poverty level. For example, a 30-day income for a one-person household would be no more than $2,127, and a 30-day income for a four-person household would be no more than $4,367. To apply or seek services, please visit our RPC website at www.ccrpc.org/COVID-19 resources to download the application and application instructions. The website also provides an email and phone number to request applications. We look forward to supporting you during this difficult time.
Okay, that concludes our presenters. So we will open that up to the media for questions. So as we've done in the past, we'll just go down our list one by one. And if you can please be specific of who the question is addressed to. So we'll start with Cale Fleming.
I don't have any questions at this time. Thank you.
Okay, thank you. Christine Herman.
Yes, so Julie, I wonder if you could just give some clarification on what happened with the Trump administration pulling funding from the 13 community-based COVID testing sites, 2 of which are in Illinois, but I understand Marketplace Mall site wasn't among them. Has it been state funded from the start and that's continuing going forward?
I'm not 100% sure, but I believe it was state funded. Yes, it used the Illinois National Guard, and it was through Illinois Emergency Management Agency. So while next month the National Guard will be pulling out of that, there is another contractor coming in that will be providing services, and we have requested and they have agreed that they will have walk-up testing as well. And we hope to be able to work with them more closely to perhaps get some more mobile type testing sites. And when I say mobile, I just mean not in that one specific location, but maybe different neighborhood type of sites that could pop up.
So you don't expect any disruption to the service there?
There should be absolutely no disruption to the service. It will continue 7 days a week from 8 a.m. to 4 p.m. We do not know if that may be expanded, the hours. We're not sure yet, but we know that it should go on at least through January, we were told.
What is the word on playgrounds in phase 4? I looked at the guidelines for Restore Illinois and it says indoor playgrounds are to remain closed. Does that mean outdoor playgrounds will reopen in Champaign County?
It's my understanding that all outdoor activities, all outdoor recreation will be allowed starting in, well, Friday, starting tomorrow. But it's important to know, and I've been trying to get this information out there, that while it will be open, that doesn't mean that anything has changed. So it's going to be incumbent upon parents to keep an eye on their children, try to keep them off of it if there's a lot of kids on there, and wash the children's hands when they're done playing. But everything will be open. But again, we still have to do the masking and the hand washing and the social distancing, especially when indoors. And the reason why the indoor things are not opening is because anything indoors just increases the likelihood of infection or an outbreak. It increases it a great deal. So that's why that's not opening.
The expectation is even at a playground, is the expectation that oh, sorry, I think
that's okay.
Oh, is the expectation that even at an outdoor playground, people will be wearing masks because they can't maintain 6 feet from each other? And does that include children?
Would we like that? Yes, of course, because if they're playing on the playground equipment and they're getting around each other, you know, there will be a chance for infection. Now, some of the playground equipment is large and really large pieces of playground equipment. So it is absolutely possible that they could stay far enough away from each other and play out there. But again, there's not going to be anyone there monitoring it. It's going to require parents to look out for their own kids when they're out there.
And then one more question, if I can, that more places are reopening, people will be out in public more. Is Champaign-Urbana Health going to make public the names of any places, restaurants, stores, gyms, churches, or even playgrounds where outbreaks are taking place so people can know if they may have been exposed?
Okay, so here's why we don't do that. We only do that if we need to. There are restaurants who have closed, for example, that we did not close them. They had a case there in an employee and they closed it. That was not required to be done. They were just doing it out of an abundance of caution. What happens when we get a positive result is that so a close contact is at least 6 feet for 15 minutes. So even in a restaurant type of setting, the employee hopefully is going to be having a mask on. And so the real risk there typically is between the employees. That's where we've been seeing the most outbreaks. Of course, now that the restaurants are opening and they're inside, that can change. And so we will have to look at every single case individually to determine that. But we don't just want to start throwing out names just because they have an employee who is positive there, because you have to remember that once we know the person's positive, they're in isolation, and anyone that had close contact with them is in quarantine. So it's not a public health issue at that time.
Thank you.
Does that make sense?
Yeah. I just know that, there's just a lot of concern about how will I know if I've been exposed? How will you contact me if you don't know I was at that playground at that time, Well,
and that is the part of the issue. So that was our concern all along. Restaurants are different because they're taking reservations and they would have ways for us to contact people if we thought that there was any type of exposure. With the playgrounds, you're exactly right. there is not going to be any way for us to know. So if we have a child or an adult who is on that, well, probably a child on the playground who tests positive, and they say to us, you know, we just spent an hour on such and such playground during my infectious period, all we're going to be able to do at that time is then go to the media, just like we have to when we don't have names for other types of situations where there could have been a potential exposure. So yes,
in an event like that, you would share that information.
Absolutely,
in an event like
yes.
That.
Yeah,
Okay.
I want to be clear that anytime there's a public health need to do so, and we do. So in a situation like that, we would just have to say, you know, if you were on this playground, if you were at this playground on this piece of playground equipment on this day, you need to contact public health, and then we would provide guidance. So yeah, we prefer to do the contact tracing, you know, the other way and not have to go out and blanket the public. But there are certain times that we don't have a choice but to do that.
Thank you.
It looks like we have Danny up next. Do you have any questions?
I do. I have a couple questions if that's okay. I think that you, Julie, I think that you may have answered some of my questions, but just to be clear, so I'm specifically asking about the events that took place in Mahomet. So
I was guessing I might get that question.
Some of the employees worked at Schnucks, Jimmy John's, and Fisher National Bank. Are you guys able to track who went through those establishments? And what advice can you give to the people who have interacted with those businesses over the last 10 to 12 days?
Yeah, so this is one of those examples of something that we got, you know, we found out about it later. We weren't exactly sure what was going on. So we did have to alert the media to let people who may have been exposed, to let them know to go and test. With that, we know that there are multiple places that, and let me explain it to you this way. Anytime we have something like that, so let's say that there is an event where, I don't know, let's just say 50 people, because that's what's going to be allowed for events. Let's say there's an event where there's 50 people, and there's exposures that happen there. We're not going to find out about those exposures until someone tests positive. And then if they don't immediately mention to us the location, then what's happening is people just continue going out. They're going to go back to their homes. They're going to infect their households, or at least expose their households. Then their households are going to go out to their jobs. The infected people are going to go out to their jobs, and that's how we have outbreaks. And that is that's always concerning to us. So in this situation, when we have the positive cases, again, just because someone is exposed, if we don't know about them, we can't quarantine them, right? So we're not going to then know we're not going to know until other people start testing positive. So we are getting on top of this, and there are quite a few places that will also be impacted by this. But again, it has to be a specific kind of contact. So it needs to be roughly 15 minutes in a 6-foot space. So that's usually coworkers, and that's not usually businesses, but it can be. So again, we have to look at every single case and determine what needs to be done. In a case like this where we didn't know the source originally, and then we found the source and we didn't have all the information, then we again have to go to the media and just kind of do a blanket appeal to people to get tested.
So even the people that have gone through those establishments, not just the ones at the event, you would suggest that they also go get tested?
No, not necessarily. Okay. So, but again, we did, you know, it's in the media, so they know that there was an event, that there was a spreading type of event. So given our numbers at the testing site yesterday, I'm guessing that a lot of people went ahead and went and tested. Certainly anyone who has a potential exposure anywhere, we encourage them to test. But and anyone with symptoms, of course. But with this, so every single node, if you will, so you have your original cases, and then from that you have other places, like people go to their jobs or their homes or whatever, and then within each of those places we're asking people based on the situation to go test. To my knowledge, there was nothing, I don't know, I haven't looked at it right this afternoon, but the contact tracers and the case investigators are the ones that talk to people directly to do that. And then if there's any need to go to the media to ask other people to test, we would do that.
Mhm.
So
you
there
mentioned-
absolutely could be situations from that. So from one event comes multiple events almost always. So and there may be something where we would have to do that again.
Okay. You said something about others who have been in contact being quarantined. Is it just those that have the positive test results, or are their families, or some of the kids play sports? Are those people asked to quarantine also?
Yes. So let's just let's just say that Mayor Finan tests positive. Let's hope not.
I
But let's
hope
just
not.
say let's just say she tests positive. We would interview her, and then we would find out. So if she had close contact with her family, which presumably she does, then they would be in quarantine. The ill person, the person that's positive, would be in isolation. It's called. It's the same thing basically, but they're in isolation. And then anyone that had a close contact with her would be in quarantine. We hope that it's only the individual's family or household unit, but depending on certain jobs or certain activities, then there are also other groups that have to be quarantined as well. And then if you work at a job, I'll use the Rantoul plant, for example. If you have a positive up there and there's no social distancing, then everybody has to go into quarantine. So there's every case, every situation is different, but it's based on that basically. Ill person gets put into isolation. We investigate, we contact trace everyone around them, put those people that had a close contact in quarantine, and then ask them to test as well.
Okay, so then kind of along the same lines, as you know, I told you I have a fairly decent list of the people who...
Hold on a second, because I'm having difficulty hearing you.
I'm sorry. Can you hear me better now?
Yes.
Okay, sorry, I moved closer to my computer. I told you this morning that I think I have a pretty decent list of people. Some of those people, it appears that they've gone out of state. How does your contact tracing with potential traveling, how does that look? Can you give us insight, or does it at all?
Yes. So yes, contact tracing, if it can reach other people in other places as well. So let's say we have an event and there are people from other counties or other states. What we would do is we would do our own, contact tracing, and then people who were exposed, who were out of state or out of the county even, then we transfer those to those jurisdictions for them to do that. So every case is reported as a case where they live, not where they test. So it is possible to have, a group of people here from out of state have an outbreak, and they would not count as cases here. They would count in their own jurisdictions, even though it could have sparked a larger outbreak here.
Okay. And then I just have one more question, and I know you might not be able to answer this, but I'm going to ask it anyway because I'm being asked a lot.
Before you ask, let me just say, because I haven't had you on a thing before, so I cannot discuss any specifics of an ongoing investigation, and I cannot discuss any names or any anything like that. So
wasn't gonna ask that. I already knew that you couldn't.
I just wanted to make sure.
Yeah. I am being asked a lot about an investigation or potential repercussions for groups of people who operate outside of whatever phase we are in the Restore Illinois plan. Since this event happened in phase 3, where there was a limit of 10 people gathering, you know, are there repercussions for events like that go outside, or is it just, are these just suggestions that we're supposed to be following?
Yeah, I don't know. That's, you know, we're busy right now trying to take care of the you know, contact tracing and trying to kind of stop the outbreak. Public health in general, our role is, you know, educational and preventative. So we always try to get information out there ahead of time and to prevent things from happening. And usually if it were like a business or something that had a repeated problem, then we would look at doing something. A one-time event like this, it's all I can say is it's very instructive. It will be very instructive to all involved, because it shows exactly, you know, kind of what we've been talking about all along, that when you have any type of indoor event that has no social distancing and no masking, you're going to have a very high likelihood for an outbreak, because the virus is out there all over the place and it transmits asymptomatically. So it's just not worth the risk.
Okay, I appreciate you taking my questions. Thank you very much.
Yeah, sure.
The next person we have, it looks like, is Lindsay.
Hi, Julie. How are you?
Good. How are you?
Good. I have a quick general question about contact tracing, since it's been brought up a few times.
Mm-hmm.
In general, you know, when you don't have an outbreak like this, your contact tracers are still working. They're still working on the individuals who tested positive. I'm wondering if you can speak to kind of, I kind of hate to use this word, but the burden almost, if there is one that an outbreak like this can cause for contact tracing. Are there consequences to what you're able to do on a day-to-day basis? Are more resources needed? That kind of thing.
Yeah, so certainly, you know, certainly anytime there's an outbreak at all, there's more need for more contact tracers. How we have it set up is that our contact tracers, if they're not in doing contact tracing, which they've been, you know, now trained for, they're in doing other parts of their job, their normal job that they would do. So yes, anytime there's any outbreak, it takes a lot of work, as you can imagine, because also everyone who is in isolation, we follow up with them every single day, and we follow up with everyone who is in quarantine every single day. You know, we check on them to make sure, see how they're doing health-wise, see if they need any, you know, food assistance. Because a lot of times when people are in isolation or quarantine, there's no money coming in and they may not have, you know, enough food to eat. It causes a lot of hardship on a lot of people. So we have to make sure that they're being taken care of when they are in isolation or quarantine. And with an event like this, or any type of actual outbreak, it's kind of like dropping a pebble in the water. You know, it starts there, but it just goes further and further out. So it takes a while to bring these under control. And an outbreak is not officially over until there are no more epi-linked cases for 28 days, basically, after anyone had any exposure.
Sure, absolutely. And I know the governor had talked about repeatedly, actually, the state's efforts to boost the number of contact tracers all over the state. Has Champaign County benefited from that, or is it public information how many contact tracers we have working for us?
Well, it's not a secret. I think we have around, right now, I think we have around 30, and we are in the process of hiring more as well, because we're gearing up for fall and winter. That is going to be, we anticipate that's going to be a lot busier time. So yeah, we are good to go. We have, you know, we do contact tracing all the time, disease specific, but that's just usually 1 or 2 people who follow up on all the reportable diseases. So this is just a whole different thing when when you're dealing with something like this in a pandemic, you're going to need a lot of contact tracing. We're really lucky in Champaign County because we have really fast test results. So we have a lot of places doing testing, not just the mall testing site, and they're using Carl's lab, which is super fast. We get the results back really quickly, and then that allows our teams to come in and like surround a case, if you will. I mean, we don't literally surround it, but you know, we come in and we get on the case and start investigating it and trying to bring it under control as fast as possible. Because the sooner we know about an infection, the sooner we can stop the spread from going out further and further.
Right, for sure. That concludes my questions. Thank you.
And it looks like we have Sam, who's next in line.
Yeah, I just had one question kind of going off the contact tracing. You said that you're in the process of hiring more, gearing up for the fall and the winter. Is there anything else that you are doing to gear up for the fall and winter that you can speak about?
That probably the contact tracing, and that is the biggest. We're also, so a lot of our services have been altered. So we're working on that. We've had to do a lot with our dental program in order to bring it up to the new standards of doing dental work during a respiratory virus like this. And you know, a lot of other things related to cross-training of staff, outreach. We're still doing lots of media, and so those are the, I think, you know, the main things. That and gearing up for drive-through flu shot clinics, because we really, as a community, we have to get our flu shot rate up much higher than it is, because the hospital systems cannot tolerate flu hospitalizations and ICUs usage during a pandemic. I mean, it's a burden on the hospital during a normal flu year. So we have to really get that up. And we're also working on preparing for, we hope, the eventuality of a vaccine. So that is, you know, a lot of that. We're also working really closely with places that are reopening, that are interested in having like a site visit or talking through some of the details of what they're doing. So we're sending staff out for that. Environmental health is still out doing their thing. And then the COVID compliance is added on to that. And then we're working closely too to get like personal protective equipment out to long-term care facilities and continue to work with them to make sure that we don't get any outbreaks in there. So it's a lot of prevention stuff, but then as soon as we're doing that and an outbreak happens, then we have to focus on that exclusively. So.
And those are all the questions I had. Thank you.
You're welcome.
Great.
One more quick one related to the nursing homes, Julie. We've had people, you know, listeners ask when will they be able to visit loved ones in nursing homes, and can you comment on that?
You know, unfortunately, this is one of those situations. Well, right now, they are allowing some outside visiting, 6 foot apart. I wish that I wish I had a better answer, but there is nothing that we know of that will allow that to be safe. It's so, you know, people in nursing homes or long-term care facilities are already vulnerable. Any type of congregate living facility, whether it is a jail or a long-term care facility or a group home, anything, they're already more at risk of having outbreaks, shelters as well. So the fewer people that go in there, the better, because you have to have the employees going in, and the employees are always the opportunity to bring in the virus. So you want to limit you don't want to have anybody else in there, no interns, no students, no anything. And unfortunately, that's no family members as well. I wish that there was some other thing, because I know it is super hard, but there just isn't. And there just isn't. And while it's not really up to us, it is up to, you know, the Illinois Department of Public Health regulates the long-term care facilities, but our guidance would be the same. There's just no way to do it safely, except for the outside 6 foot or more apart, that type of thing. That is allowed right now, but I get it. It's not the same. I mean, I understand that. So the unfortunate answer is probably not until the pandemic is over.
If there are no other questions, then that will conclude our press briefing for today. We appreciate everyone's participation. And then we'll just leave you with a couple local resources we like to remind everyone of. It's champaign-county-covid19.org. And then 211, anyone seeking resources can speak with a trained specialist by calling 211 or visiting uwayhelps.org/211. Thank you.
Thank you.
Thank you.
Thank you.